Hi there, Dr. Gary here on the road. We sell dental practices nationwide. We are dental practice brokers. I was a dentist for 25 years and now doing the dental practice brokerage for 15. Today's topic is communication with a challenging dental landlord. Now, before I get into that, we have 10 employees, including 2 CPA accountants, and we're available to you 363 days a year, except Christmas and Easter. So you can call us anytime from 8 a.m. till 8 p.m. East Coast time. Just give us a call. Be happy to chat with you. Now, all the information you're about to hear is for entertainment purposes only. It's not legal or business advice. So, and also, if you're thinking about selling your practice to one of the DSOs, call us. We've been working with them for a long time. We have multiple number of DSOs, I think 140 of them we communicate with. We're independent of them, but often they will pay our commission. So generally there's no commission for a seller when you have one of the bigger practice sales, over $1.2 million, multiple chairs, willing to stay on. We'll help you out there. Now, if it's a large practice and the final sale price is over $1 million, we'll get your legal fees reimbursed upon successful closing. We've done that multiple times based on some small criteria. Anyway, let's get into what's going on with the landlord. Now, the buyer's approved. Everything's ready to go. Buyer's happy, seller's happy, contracts are done. Everything's been done except the final negotiations of the landlord, which should occur concurrently as you're creating the contracts, as you're finalizing your loan. But everything is set. Contract is set. Bank financing is set and agreed. So pretty much it's all moving forward. Everything's done. And simultaneously they were negotiating with the landlord. Now, we have a certain situation here, a little particular, because the buyer is very interested in this space next door and is sort of trying to pre-negotiate that. But the space next door is empty. Doesn't have to have it, but everybody thinks they're going to do this multidisciplinary dentistry, have 6, 7, 8 chairs going, all kinds of professionals in there. It's okay. I mean, I think the buyer's leaping a little bit too much. So that's sort of in the negotiations a little bit. But as most buyers, they don't have much money. So the landlord's a little hesitant, especially a landlord that is in a space that's fully booked. Fully occupied, no vacancies. Now, mind you, landlords will often resist a little bit a new buyer, a new tenant. Why should they? They have the seller on the hook generally for several years. The seller's been paying them consistently. Seller, dentist, generally never complains. So the landlord has to go through this whole thing with more risk. Remember, landlord has no history with the buyer. Oh, before I forget, you can reach us at 201-663-0935, and our website is dentalpracticeguide.com or nationwidedentalpracticebrokers.com. So the landlord has a history with the seller. You bring a new person in, it's risk. That's how the landlord looks at it. Buyer thinks, well, I'm going to be a long-term tenant. Well, the other doctor was a long-term tenant too. And you don't have as much, your financial picture is not as strong as the selling doctor. Therefore, it's more risk. That's what's going on. Now, the other thing is a buyer buying a dental office, generally, this is the biggest thing so far they've done in your life. Aside from maybe buying a car or possibly a house, this will be the second big thing. So every time they hit a little rough patch, the buyer starts to get panicking. Like, the landlord's not treating me nicely. What's going to happen with this landlord down the road? Also, I'm interested in the space next door. I said, you shouldn't focus on the space next door right now. You could do something as an option. You have to focus on this practice in this space right now. That's what your main focus is. Don't get sidetracked. So the buyer's hemming and hawing, and the landlord's saying, well, look, being that I don't know you, and you have a weak financial structure, and I know you want the space next door, I'm going to need a much higher security deposit. And the landlord's within his rights to do that. How much that could be, generally they want 1, 2, 3 months, somewhere around there. Generally at least 2 months. In this situation, the landlord says, well, give me a full year, which would be 9 months more. 9 months more than normal. Okay, it's a little high. But you can understand it's giving the landlord comfort. And you're going to be making money. You as a buyer are going to be making money there. Whatever practice it is, it's a good chance, based on national averages, you will do better. You'll do better in the next few years. Should go up 20%. So, and also when you work for somebody else, I told the buyer, don't default on the fact that you have a gainfully employed job right now. Forget that, because you could lose your job. The seller could sell. You can get disabled, and you lose 25% of your income because you don't have your own business. So either way, don't count on the fact you have a good job. It's a big mistake that a lot of the buyers fall back onto. Well, I'm making big money. Yeah, that's today. You get hurt today, you're out of work tomorrow. Even if you have disability, it's not going to probably pay all your bills. So I kind of got that through the buyer's head. And I said to the buyer, the landlord is in the driver's seat. If you don't take this deal, you got to start all over again. You got to pay your attorney, and every deal has a mini roadblock. You as the buyer, you're going to run into a roadblock, every deal. So this deal, the problem is the landlord. Okay, the next deal, it's going to be something else. You may not like the makeup or you may not get in the PPO you want to get in, or the staff is leaving. I don't know what the problem's going to be. There's always a problem. So right now you're dealing with the landlord, and who's to say the next landlord is not going to give you a hard time like this one's giving him? Who's to say? You don't know. My advice to the buyer, yes, you had some troubled waters. I told you we'd reach a roadblock. Get through this. Throw the extra money at the landlord for the security. The landlord will be happy. And forget the fact you're not getting along with the landlord and you think the landlord's not going to like you in the future and stop you from getting that space maybe next door or whatever. Just forget that for now. Right now, lock up the deal. Do what you have to. I understand. I told the buyer, hey, I did this 35 years ago and I had my practice. It was my first deal. And I was nervous, checking this, checking that. I had no history. But being what I know, and after you, doctor, after a few years, you'll see if you deal with a couple of landlords, it's not that hard. So that is our message. It's never easy. There's always a roadblock. Success is not easy. You just got to get off of it. Just get off of it and move forward, because you're losing money every day. You're losing equity every day. You're losing your goodwill you're building up every day. Stop delaying. Yes, you got a little issue with the landlord. Yes, I appreciate what you're going to. But you got to just plow through this and get through your problem. But if your only problem is the landlord, get this done. All right? All right, team, signing off. Dr. Gary here. We just came back from 3 different trips, 2 cruises, and then one of those all-inclusives. Let's talk about that on the next tape or so. We had a blast. We had great doctors that came, professionals, dental attorneys, dental banks, dental CPAs, dental contractors. I mean, we had a really good team. And then I also checked out another cruise, the largest cruise ship in the world. That was the Icon of the Seas. Unbelievable. I want to do a lecture cruise on that, so I took some videos of that, see how you like it. Get in touch with us. You know, these cruises, you have to book them a year in advance, a year and a half in advance, sometimes 2 years. They are filling up. And you say, I don't know what I'll be doing in a year and a half. Well, the cruise ship's filling up. You're going to lose those ocean view cabins, and I can only reserve so many. We got everything set up. We have a travel agent that will handle everything. Call me. We'll make this happen. And we'll get on it. Now, we have a bunch of tapes we did, videos from the other, from the cruise ship and from the all-inclusive. That all-inclusive could work out night, too. 7 nights, and everything's included. All the food, all the entertainment, all the drink, hotel, transfers from the airport. But that really worked out nice. And I think it'd be a nice environment. We could sit, we could hang out, quiet, one-on-one, and just share what your thoughts are on problems. So call me if you want to get on these trips. I'm already planning for next year. I think January 12th is our first one, and then I'll get one together for one of these all-inclusives. So call us, working it, make it happen, guys and gals. We're moving forward. Thank you. Bye now.